Thank you to the panel for your time today. This is such an important issue. As has been said by many of my colleagues, it affects all of our districts. It affects people all across every demographic around this country. And so I appreciate your great work and the time you devoted today to this hearing. Dr. Gottlieb, your testimony, you note the FDA, through its Sentinel database, is using data to assess prescribing and usage patterns by medical indication and provider specialty. You note this analysis is still ongoing, but can you talk more about the Sentinel database and any preliminary findings FDA has on potential over-prescribing?
What we've been able to do is use our Sentinel database to look at prescribing by indication and look at how many pills are being prescribed based on an indication. We've looked across about 15 different common indications, and then look at how many pills are left over after the patient completes the prescription. And so we've been able to derive where we see excess prescribing. We actually found a couple of indications where we see patients seeking another prescription, but in the vast majority of the indications, there's excess supply, and sometimes there's significant excess supply, which leads to the problems that we've been discussing here today. We're going to find a venue to make this public, this information public at some point in the future. It's proprietary information, but we will be finding a way to publish this. This is a very important tool for us because this clearly informs the policy decisions that we're making.
I appreciate that. You also mentioned FDA's reviewed published literature on pills dispensed, used, and left over by patients who were prescribed opioids. Can you give any specifics on the number of pills left over, or if not, have you been able to determine how often pills are left over?
If I remember the data correctly, and I'd be happy to follow up with your office to get you a more precise answer. We looked across about 15 indications, and in all but 2 there was leftover, and in most there was a significant percentage of the pills that were prescribed were left over. So it's a common phenomenon.
I appreciate that. If you would help us get that information. But do you believe then that if consumers had easier access to convenient disposal of disposal methods that would help mitigate this oversupply of opioids?
We do. We think that could help.
Great. Well, we look forward to working with you on that. And if my colleague Buddy Carter would like some of my time, I'd be happy to yield to.
Thank you. I thank the gentleman for yielding. Just very quickly, Dr. Gottlieb, I wanted to also follow up on what I believe one of the other members on the other side of the aisle had mentioned about about when the drugs come through the international